Hello again, I'm back, and in this chapter we'll be talking about genitourinary and obstetrics coding. This is a very complicated chapter, but bear in mind one thing. If a pregnancy or a delivery is complicated by an infectious disease, HIV/AIDS, whatever it is, it goes in the OB chapter. All these codes start with an O. Let's take a closer look at what's coding some of these disorders involves. Again, some terms, a lot of these we're familiar with in terms of genitourinary for men, women, things like BPH, benign prostatic hyperplasia, deformity, genetics, GFRs, GYNs, all these different types of things. Mortality, obstetrics, different than GYN, prenatal, puerperium, UTIs, and more. One of the things that we look at with the urinary system is the kidney. We have two of them, right and left, and they're connected to this bladder by the ureter, not to be confused with the urethra. The urethra is the passage from the urinary bladder to the outside. Tools that we use, blood test, of course, the kidney, ureter, bladder, the KUBs for imaging, ultrasounds, for fluoroscopy, CTs, MRIs, IVPs. And one of the things we look at is chronic kidney disease. Chronic kidney disease is put into 5 different stages, right? We would say 6 if you wanted to count end-stage renal disease, right? In other words, this is stage 5 that requires renal dialysis or transplantation. So based on the GFRs, right, we can have chronic kidney disease stage 1, chronic kidney disease stage 2, and so on, all the way up to end-stage renal disease, which is 6. Your code book lays out what the GFRs are. The important thing to remember is that chronic kidney disease, the 3-character code is N18, and the 4th digit is the stage, and it matches stage 1, 4th character will be 1, and so on. Hypertensive chronic kidney disease is when a patient has both hypertension and chronic kidney disease, and there's a cause and effect relationship between the two. The physician does not specifically have to say that one caused the other. It's understood. So if you have hypertensive chronic kidney disease, it will be something coded from I-12, which we took a look at earlier. When we have diabetes with renal manifestations, we have these diabetic codes. As we talked about when we coded diabetes cases, these are combination codes that get both the diabetes and the renal manifestation, the nephropathy, if you will. And they can be either type 1 or type 2. Again, people are familiar with dialysis. This is another thing that will involve status, right? And we have 2 of them that you can see at the bottom of this slide here, the Z4901 and counter for fitting and adjustment of the catheter for dialysis, and Z49.02 and counter for fitting and adjustment of the peritoneal dialysis catheter. Remember, we always think of dialysis as the extracorporeal. We can also have peritoneal dialysis as well. Transplantation, again, when we talk about coding things, we want to code anything that, even if the patient's here for something else, that may affect the care, evaluation, and management of the patient. This would include such things as transplant status, being a kidney donor, kidney transplant rejection, which is an effect that we talked about. So it gets coded out of the T86.11 and 12 and 13. All these things that can go wrong with them, complications, and so on. Acute renal failure is a chronic kidney injury which is caused by some sort of malfunction on the kidney. This could be an obstruction, say BPH or a stone or something else, right? Then we may also have the N10, the acute polynephritis. Urinary tract infections, commonly referred to as N30, the cystitis. Most of these are caused by gram-negative enteric bacteria, and the pathology report usually spells these out. You'll note in your code book, it will be a notation to identify the infectious agent. And that's all I have for you. Come back for our next set of lectures. We'll be talking more about urinary and obstetrics and GYN coding disorders, coding of those disorders. Thank you so much. We'll see you then.